So I would like to introduce our next speaker now, and that is Stefan Philipp. And Stefan is a researcher at the Center for Social Innovation in Vienna, where he currently coordinates the Horizon 2020 project CHERRIES. And this morning, Stefan is going to talk to us about the CHERRIES project. So Stefan, if you're sharing your screen already there. So I'll now hand over to you.
Hello, good morning from my side. As has already been said, my name is Stefan Philipp. I have the pleasure to coordinate the CHERRIES project, and I would like to thank the Sapphire organizers for inviting me. My presentation is a little bit different. It's not about personalized medicine, but it's about RRI in regional healthcare and our open innovation approach to bottom-up and demand-oriented innovation in the healthcare sector. As has been mentioned already quite a few times, also CHERRIES is positioned between RI practices as responsible research and innovation, between smart specialization as regional approaches to regional healthcare policy making. And we aim to include this new mission challenge-driven approaches to innovation policy that are getting more important on the European side, with a specific focus on the demand side of innovation policy. Instruments which are often a little bit neglected in the whole policy mix. A little bit of context what we are doing. We are seeing in the healthcare sectors increasing pressures due to the changes in our age structure. Mostly we are getting older. We are having comorbidities that need to be managed. It's not so much binary state between healthy and sick, and you go to the hospital and you leave it sick, healthy, sorry. But it's a managing comorbidities between different specialists. This is increasing the pressure on the healthcare sector to reduce costs while improving the quality, which makes innovation more and more a critical factor for the organization within the healthcare system. At the same time, we also see that often there are innovations in the healthcare sector that are proven somehow in their context to be valuable, but they still not are taking up. And this is basically what we want to address in CHERRIES. We say, okay, demand-side instruments, co-creation, and RI approaches could help us to mitigate these issues. We are taking a clear innovation system focus on healthcare innovation, which is often not there because it's a really complex system, and managing it with system thinking is often really, really challenging. Even what I show this picture here for is really like to see, okay, we are having different spheres that are influencing innovation. We have science communities that are, if they are spin-off into the technology market, are shaping the market for drugs and devices. Then we have a middle layer, which is called here service provision. It's the organizational layer of the healthcare sectors, how it's organized. And this is providing healthcare service in a delivery system directly to the individual sphere. And innovation somehow must arise in this triangle. But these triangles are often not well aligned. And the alignment of healthcare innovation or societal expectations is our aim, and we think it will help innovations in the healthcare sector to establish themselves in the markets better. And at the same time, this complex situation of the healthcare sector, these multiple challenges need the transformation of a complex system in a multi-level governance setting with multi-scalar policies. And at the same time, this needs to interfere in a sector that's often really has silos within and between organizations. So, for example, if there is innovation where one organization would have an innovation and would need to pay for it, but the profit appears somewhere else in the system, this organization might not willing to spend this money, even though for the whole system it would be beneficial. And then healthcare innovation is a really, really broad term. When we heard about precision medicine, we're talking about personalized medicine, but it could also be just promotive or preventive measures. Then, of course, we have the curative setting, but also the rehabilitative and assistive dimension of healthcare. Plus, we are, my background is innovation studies. It's not only about products, it's also about processes, about social dimensions that are interfering in this sector. So what is the spatial dimension actually of healthcare? I find this picture very useful because it depends really on the innovation mode that is underlying this innovation. Is it science, technology, innovation driven, or is it something that is coming out of doing, using, interacting with different stakeholders? One is more a global expert system, how we really think about science, and the other one is more the incremental approach of fixing small problems or also big problems. And the evaluation mode, can I standardize and scale my process, or is it really like custom made for a specific context? This is having a big impact if you want to use innovation as a driver for regional development. A footloose innovation system might be less well adjusted to really create a regional economic benefit. And I think, for example, if we think about the precision medicine and the genomics or vaccine development, we really have global systems, while when we think about e-health, telemedicine solutions, probably it's more regional, local innovation and valuation systems. So there are different dimensions that shape the whole innovation system that's underlying. That's something that's really important to take into account when you talk about healthcare innovation in regional contexts. What are we doing in CHERRIES in this regards? CHERRIES, like, first, it has 3 phases. First phase was mapping, reflecting on the systems in the 3 regions. The 3 regions are Örebro in Sweden, Murcia in Spain, and the Republic of Cyprus. The second phase, where we are currently, is really like a core experiment, and we'll come to that later. And the third phase is the sustainability of the process in the regions, but also beyond the regions. What we are trying to do with the mapping is to basically understand the regions, reflect with the stakeholders, anticipate problems, be responsive, be inclusive in identifying the regional strengths, priorities, and subsequently the needs. And you can see here a little bit of the regional specificities, but I'm not going to read that now. I think that's the most important thing for this presentation today is the CHERRIES model, the core experiment. What we're trying to do is an RRI experiment based on open innovation approaches, tackling sectoral needs. We start here on the left side, the need identification. We had an open call for needs with our regional stakeholder system, basically asking them to describe what they perceive as problem in their daily work or in their daily lives, because we really opened it also to citizens, not only healthcare professionals. Then we selected one need in each region, created a call for solutions, defining some technical requirements, and fine-tuning what we actually understood in this need. Different kind of actors applied with solutions to this kind of needs. And we are selecting one solution provider per region, who then will go to a co-creation process between the people who are suggesting the solution and the people who identified the need, in order to make sure that the need and the solution are fitting in together well, that it's well aligned, that it fits the context, and it's really useful for the people who are identified this need first. The solution provider then will get some market expertise, and the whole process is monitored, evaluated, and then we'll feed into some reflection about the regional policy making, how we can anchor this kind of open processes within regional demand-oriented innovation policy mix. What came out of that? We had a really place-based approach. So we were really like addressing stakeholders based on the regional cultures in Sweden. We really were open. We were really going to citizens themselves. In Murcia, it was more about opening routines that were already there in the healthcare sector, by including also patient organizations and so on. And Cyprus was really like directly addressing the healthcare professionals and patient organizations in order to create some momentum, because the sphere that we were interfering from was more from the business side. You see, we identified 3 very different needs. Involuntary loneliness in elderly people in a partly sparsely populated area in Sweden. Also to that, Cypriotic people that are living in rural areas and don't have so much a good connection to the healthcare sector. It's also applying to citizens that are living on the Turkish side of the island. And in Luthia, how can we detect the progression of multiple sclerosis early and make sure that it doesn't get bad? We are in the middle of the process of selecting the solutions. In Cyprus, the decision will be made today. In Sweden, we found a way that seniors are living with seniors. It's really social innovation coordinated by a municipality who is bringing together and networking organizations that are already dealing with issues in this sector. While in Luthia, it's really an ICT, Internet of Things, e-health platform and kinetic algorithm that will monitor and track the patient and try to identify MS progression early. Another thing that we will do in a coming phase of the project, sustainability, we want to create a European community of regions that are working with similar approaches. We want to share our learnings and support them in building models like this in their regional context. There will be some training, there will be the ability to visit our regions. So if you're interested in that, please follow us for updates. Call for Mirror Regions will be launched late summer this year, most likely. We are on Twitter, we are on LinkedIn, and we have a newsletter. So if you're interested in the project and in our process, please follow us. And with that, I would close my presentation and I'm looking forward to questions. Thank you.
Yeah, thanks a lot for this interesting presentation, Stefan. So for how long your project is running, actually?
We started early in 2020, as in January 2020. We are at halftime right now. Last week we had a review meeting. It's a Horizon project, it's CSA tool. So this first phase, mapping the whole ecosystems, seeing what kind of specializations there, who are the stakeholder ecosystems, who are stakeholders that are probably missing on the mental map of our core partners, and reflecting together with the stakeholders about the processes in the region and where there might be some need for opening up or for doing things differently. Finished. We had to do this whole reflection process during Corona, which was really challenging. Reflecting with the stakeholders of the healthcare sector this time was really not easy. We managed. Now the second phase, the second year is mostly the development of these solutions, co-creation, and the third year or second half now of the project is about building this European community and about the policy work within the 3 regions. Mm-hmm. So we still have 1.5 years to go.
And so now you are working with 3 regions, and so your idea is to work with other regions in the second part?
Yes, we want to open this up. We want to create some kind of a community of regions dealing with healthcare, open innovation in a context like this. We want to have at least 3 regions for some intense knowledge transfer. But we are not limited to the 3 regions. And now, but the proposal was written before Corona. Yeah? Now we know that there are many knowledge transfer mechanisms that also can work rather well online. So we really are open to create a rather big community and then also exploit the results and everything that we're building in this project, also in the context, for example, of an Interreg Europe project. That is one of the things that we are thinking about. Yeah.
And so at the moment, what would be your key messages of the project? Or
I think it's very important and very good to open up the discussion reflect together with stakeholders where you are, which direction do you want to develop, and what is necessary to do this way. And what we did with this call for needs is really that we participated with our stakeholders on a very fundamental level. We are not getting them in late and fine-tune the solution that we think is good. We are really include them already in the problem definition, which is really giving them a meaningful voice in this whole process. At the same time, this is challenging. And there are various problems then in identifying what is a need that can fit this instrument. There's questions of granularity. There is how much money can I use in the solution? How can I translate need into technical requirements for a call for solution? Then in the end, what we are doing is some kind of a procurement for innovation process, actually. How can I define these requirements? And another thing connected to our model that is really challenging for many stakeholders is actually to really think about the need, because it is arising from their professional context or from their life when they are dealing with chronic illnesses. They already thought about solutions, not about needs. Like taking this step back and really like reflect, what is the need that I need to address? It's not easy for stakeholders, and that needed us some training and some guidance in order to describe the need in a rather holistic manner.
And so if regions want to be part of the community or to work in the second stage of the project, how do they have to proceed?
Yeah, we will launch a call for mirror territories and mirror regions probably in September. It's the current timeline. The timeline is a little bit messed up of Corona, of course. But it should be open in September. Just follow us for updates. You will not miss it. We will make fuss online in order to create some awareness. So just get in contact with us.
Yeah, because the three actual regions have very different projects, very different specifics, and yeah, so it's really interesting to have these three different regions that are really different on innovation and
yes,
density and so on, and on the project itself.
Yeah, no, I think what is really the beauty of the CHERRIES project is that we took this model that is, of course, like you saw the picture, it's a schematic model. And we went to the regions and we really adjusted it to the regional trajectories and culture, and stakeholders in the regions made it their own. And I think that is one of the things that is really needed in regional innovation policies, that you are really taking this place-based approach and fit it to the regional requirements. And yes, you're right. I mean, when you look at the technical capabilities of the region, Örebro is one of the most innovative regions in Europe. At the same time, we were really dealing with the social sphere of the healthcare sector there. That's completely different in Murcia. That is, when you look at the indicators, is not that innovative, but in terms of e-health, they have a very strong culture and working with startups and SMEs. So there are different foci, and the overall logic of call for needs, call for solutions, and then co-creation can be adjusted very flexible.
Okay, thanks a lot. So I hope you can stay till the end, because I still have some questions, and if the audience has some questions, they can put it in the chat for later on. So thanks a lot.
Thank you.
Bye. And so now I let over to Sorka. Thanks.